Uh, Hi everyone. Good morning. My name is Irfan. I am pharmacist here in DPRC. Uh, Today's topic is food-drug interactions, and this is first slide for the contents. Contents are introduction. What are the drug interactions? Drug interaction types. Food-drug interaction mechanism of food-drug interaction. Consequences of food-drug interactions, and benefits of minimizing food drug interactions, effects of food drug interactions, effect of food on drug absorption. So let's move on the our next slide, introduction. Perhaps everyone maybe feels perhaps the most common question patients ask about their medication, aside from why does this medication cost so much, is should I take this medication with or without food? In most cases, upon looking in the package insert or drug information resource, the patient discovers the most drugs in question may be administered without regard to meals or with meals. So anyone can see in the leaflet, so this drug can be taken with or without food. So now we will move the next slide, which is the drug interaction. As you can see in the picture as well, drug interaction is an interaction between a drug and some other substance, such as another drug or a certain type of food, which prevents the drug from working correctly. So there is drug interaction types also. The first one is drug-drug interaction. Like for example, ketoconazole interact with antacid, like Gaviscon and any calcium and aluminum containing antacids. So uh, that antacid decreases dissolution bioavailability through food drug interaction. Number two, for example, inhibition of metabolism of several drugs by grapefruit juice. Chemical drug interactions, third one, and example is interaction of a drug with alcohol, tobacco, and environmental chemicals. And the fourth one is drug disease interaction. For example, worsening of disease condition by the drug. And today topic is because of food drug interactions. The definition of the food drug interaction is food drug interaction is defined as alteration of pharmacodynamics or pharmacokinetics of a drug or a nutritional element, or a compromise in nutritional status as a result of the addition of the drug. The mechanism of the drug interaction is, as you can see in the picture in the right side, drug and nutrition or food we are taking together, and in the response of that, three responses are coming: pharmaceutical, pharmacokinetics, and pharmacodynamics. In the pharmaceutical, compatibility, solubility, and stability is happening. Like Panadol has improved a lot of, after research, they improve the solubility of the tablet, and increases from 15 minutes to 3 minutes to 5 minutes. Like pharmacokinetics also. In the pharmacokinetics, we will see absorption, distribution, metabolism, and excretion of the drug. And in the pharmacodynamics, like signal transduction, uh, genetic polymorphism, enzyme uh, blockage, or increasing transporters and receptors. In these three categories, the response will come of the drug and the food. And in three in together in three responses, the final result will come physiological outcome. What happens in that? Bioavailability increase or decrease, volume of distribution increase or decrease, clearance, and biomarkers also, like mostly CT scan and other MRI, they are putting the biomarkers to scan the things. It is also depends on the food intake and uh, uh, just metabolism and excretion from the body. So they can the time is depending on that things in the body. And the final outcome is coming patient outcome. There are negative is, if the outcome is negative, the condition will be worsened or toxic or infective. There is no outcome comes the nutrition status and drug effects. They are the two things which come. If this is a positive, it will be improved and optimal. As you can see in the left side, the mechanisms are characterized by pharmacokinetics and pharmacodynamics. Several pharmacokinetics mechanism may occur when there is an increase or decrease in absorption of a drug into the body, distribution, metabolism, and elimination of a drug from the body. Mostly in pharmacokinetics, the drug is doing an effect on body. And on pharmacodynamics, an addition activity of the drug due to food is a classic example of a pharmacodynamics interaction. For example, the anticoagulant effect of warfarin is enhanced by ginkgo biloba. And after this, the consequences of interactions will come. Nutrition drug interaction can lead to nutrition imbalance, or it can interfere with drug effectiveness. Adverse interactions occur most likely if drugs are taken over long periods, if several drugs are taken, or if nutrition status is poor. Elderly people with chronic diseases are most vulnerable. So this one, the food and drug interactions, these are doing, the effects are happening with each other. So drugs can alter nutrition absorption by changing the acidity of digestive tract, like antacids can interfere with iron absorption, like calcium and iron cannot be taken together, otherwise chelation will occur and no absorption will happen. Altering digestive juices, cimetidine can improve fat absorption. Altering motility of digestive tract, laxative speed motility, causing in malabsorption of many nutrients. In activating enzyme system, neomycin may reduce lipase activities, damaging mucosal cells. Chemotherapy can damage mucosal cells. Binding to nutrients, antacids bind phosphorus. Foods can alter drug absorption by, yani, up is drugs can alter nutrition. Now foods can alter drug absorption, changing the acidity of digestive tract. Foods like candy can change the acidity, thus dissolving slow acting asthma medication too quickly. Like some medications are slow or releasing, extended releasing tablets, they will dissolve very quickly. So the 24-hour effect will be reduced. Stimulating secretion of digestive juices, grazofolmin is absorbed better when taken with foods that stimulate the release of digestive enzymes. Altering rate of absorption, aspirin is absorbed more slowly when taken with food. Binding to drugs, calcium binds to tetracycline, limiting drug absorption. Mostly when this drug antibiotic is taken, we are telling that do not take any calcium, milk, yogurt, anything or supplements like calcium. Competing for absorption sites in the intestine. Dietary amino acid interfere with levodopa absorption this way. The next is drugs and nutrition can interact and alter metabolism as well. Acting as structural analogs like anticoagulants and vitamin K do, competing with each other for metabolic enzyme systems as phenobarbital or folate do. Altering enzyme activity and contributing pharmacologically active substances as monoamine oxidase inhibitors and tyramine do. Drugs can alter nutrition excretion by altering reabsorption in the kidney, like some diuretics increase the excretion of sodium and potassium, and displacing nutrition from their plasma protein carriers, like aspirin displaces folate. Food can alter drug excretion by, yani now the drug, food is affecting on excretion of a drug. Changing the acidity of the urine, like vitamin C can alter urinary pH and limit the excretion of aspirin. And pharmacokinetic interactions, as you know, we are studying that there are three types, like drug absorption, drug excretion, and drug metabolism. An example with the example is defined here. Food may affect drug absorption in the GI tract by altering gastric pH. secretion, gastrointestinal motility, and transit time. This may result in a change in the rate of absorption or extent of a drug absorption or both. Like for example, azithromycin absorption is decreased when it is taken with food, resulting in a 43% reduction in bioavailability. This antibiotic is we are commonly using. If we will not take in an empty stomach, the absorption will be decreased with the food. So at least 1 or 2 hours before or 1 or 2 hours after we have to take this medication to get the maximum bioavailability and effect. Because this is a not time limiting medication like augmentin. We have to take every 12 hours. This is a concentration dependent antibiotic, so we need some minimum effective concentration in the body to get a result. So food will reduce the effect of the antibiotic in the body if interfere with the antibiotic. So better we can take it in empty stomach. Second is excretion. Foods may alter the urinary pH, which can affect the activity of certain drugs. The half-life of some medication can be significantly changed by alteration in urinary pH. Therefore, the half-life of acidic drugs will be extended in acidic urine because the drugs is in its unionized form. However, the half-life of an acidic drug in alkaline urine is reduced because the drug is in its ionized form. And third is drug metabolism. Food may alter the hepatic metabolism of some drugs. It has been reported that when administered with the antihypertensive drug like felodipine, concentrated grapefruit juice caused an increase in the bioavailability of felodipine. The mean felodipine bioavailability with grapefruit juice was 284%. That of this range with the water. This resulted in lower diastolic blood pressure and increased heart rate in the male study volunteers. Now the pharmacokinetics interactions, example of drug-food interactions that delay the absorption of drugs. Like for these are the some of examples like acetaminophen, like Panadol. High pectin starch fiber foods act as an absorber and protectant, like apple juice and citrus juices like oranges. They have a pectin and fiber, so they can reduce the, because this medication will be absorbed on that pectin and starch, so the effect will be less. So better take on empty stomach if not contraindicated, either 1 hour or 1 hour before or after the food. Digoxin, like high fiber, high pectin foods bind to the drug. Take drug at the same time as foods. Avoid taking with high fiber foods. Same like levodopa, and in this DPRC pharmacy, it is available. Like Dr. PR can write it. Drug compete with amino acid for absorption transport. Avoid taking drug with high protein foods like glipizide, quinidine, methyl dopa, and sulfonamides and tetracycline. As you know, this is if we will take with the calcium, and the absorption will be very less. And third one, uh, example of drug-food interaction that accelerate the absorption of drugs. That one will be like grazofulvin and propranolol. The grazofulvin drug is lipid soluble. This drug is lipid soluble and easily absorbed in the body with the lipids or fats available in the stomach. So enhance absorption with high fat foods. So it means we can take this medication with high fat foods. Better to take with empty stomach or less high fat foods. Propranolol, propranolol food may reduce first pass extraction and metabolism. Take with food, it is much better. Now the pharmacodynamics interactions. Foods may interact with medication by altering their pharmacological actions. Diets high in vitamin K may cause antagonism of warfarin and decrease therapeutic efficacy of anticoagulants. And example is like potassium rich foods. They can interact like this way, like ACEI and ARBs. drug renin inhibitor, allocequerone, or potassium sparing diuretic like spironolactone, etc. They can, what mechanism is in that when we are taking that drugs, the potassium will increase in our body, and they are acting like lowering of aldosterone levels, and result of that increased potassium retention in the body. And if we will take the foods which those who are potassium rich food, the hyperkalemia will occur in our body. Specific counseling on some food drug interactions we needed, like antibiotics, cephalosporins, penicillin, erythromycin, sulfur drugs, tetracyclines. So we can take on an empty stomach to speed absorption of drugs. Do not take with fruit juices or wine, which decreases the drug's effectiveness. Increase the risk of vitamin B12 deficiency. Dairy products reduce the drug's effectiveness. Lowers vitamin C absorption as well if we will take with these antibiotics. So we make a little gap in between them. Asthmatic drugs like pseudoephedrine and theophylline. Avoid caffeine, which increases feelings of anxiety and nervousness. High protein diet reduces absorption. Caffeine increases the risk of drug toxicity. Like laxative mineral oils overuse can cause a deficiency of vitamin A, D, E, and K. Painkillers, mostly aspirin and stronger NSAIDs, always take with food to lower the risk of gastrointestinal irritation. Avoid taking with alcohol, which increase the risk of bleeding. Frequent use of these drugs lower the absorption of folate and vitamin C. Increase fiber and water intake to avoid constipation. And selected food drug interaction and their clinical implications, like grapefruit juice, drugs that prolong repolarization like amiodarone, cardrone, and what is the effect will come significantly enhanced toxicity. Better to give on empty stomach 1 hour before or 2 hours after meal or snack. Same like other fermented meats, they can interact with monoamine oxidase. Soybean formulas like thyroid supplements decrease absorption, increase fecal elimination. So avoid taking soybean formulas. Limit food high in iodine such as rutabaga, soybeans, or turnips. So high carbohydrate meals like they will interact with the respiratory. Medications may cause nausea, vomiting, headache. So better to avoid with that product drugs. High fat meals, bronchodilators, theophylline decreases absorption of drug, may cause nausea, vomiting, headache. Avoid high fat meals or supplements. Same selected nutrient drug interaction and their clinical implication here. Meals that high in pyridoxine B6, anti-Parkinson drugs, they can interact, decrease absorption of the drug, increase symptoms. Limit foods rich in pyridoxine, such as chicken, fish, liver, and kidney. And vitamin K, as we studied before, they can interact with anticoagulants. High dose high dose vitamin K, yani medication affecting the blood and blood forming organs, anticoagulant effects, yani prolongs clotting time, yani vitamin K prolongs clotting time and increase the risk of bleeding. So avoid the food which is interacting with this way. So iodine, metformin, decrease absorption, increases fecal elimination. Limit foods high in iodine, such as Brussels sprout, cabbage, and soybeans. So thank you so much, all of you.